India. Stan, it's Andrew. Can you hear me? Stan, it's Andrew. Can you hear me? Can anyone hear me?
Yes.
Thank you.
What the hell is that?
Please call our roll for donations.
Lee Turpin,
Here.
Darren Hoggett,
Here.
Dr. Lisa Clenny,
I'm here virtually.
Matthew Shady,
Here.
Jerry Harder,
Here.
John Zartman,
Here.
Dr. Sarah Brown. Here. Matthew McConaughey. Oh, sorry, McCullough. Andrew Bowman,
Here from New Orleans.
Marion Dudley. Here. Dr. Jim Nussett,
He said he would probably not be on tonight.
Lori Maley. Here. Jonathan Whitman.
Jonathan is on his way. He'll be joining shortly.
All right.
Okay, we have a poll. Everybody, please stand and face the flag. Pledge of allegiance to the flag of the United States of America and to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all. Thank you. First off, we'd like to have Chief Adam Farrar, Chief Association, come forward for a welcome.
Want to welcome everybody to our conference. Thank you. Thanks to the commission for having the meeting here. While you guys are here, enjoy the conference. Any questions, let us know. I'm happy to say that I'm the outgoing president and one of your own commission members will be taking my place in about 2.5 hours after we've taken that role. And Jared's in the back, he's our EMS section, so you support the EMS commission and anything EMS related from our association. So thanks again for being here. Thanks for having me here at our conference. Have a nice week.
Thank you. Next up on the agenda, adoption of the pleasure of possession. Motion approved.
Second.
Approved, second. Any further discussion? We have virtual members online, so we'll make a roll call.
Just a few minor typos, nothing of significance.
Trustee McKenzie, Andrew.
I didn't hear him.
Andrew, were you requesting any changes with that or just noting the typos?
I can't even hear you out here, Lee.
It's all. Okay. Andrew, were you requesting any changes or just noting the typos?
Just minor typos, nothing of significance, except looks like your name is misspelled. It's a couple of spots, but no biggie.
All right, thank you. So we have motion and second. Any further discussion on adoption of minutes? Wait,
Okay. Lee Turpin, Darren Hoggett,
Aye.
Dr. Lisa Clenny,
Aye.
Shady,
Aye.
Jerry Harder,
Aye.
John Zartman,
Aye.
Dr. Sarah Brown. Aye. Matthew McCullough,
Aye.
Andrew Bowman. Marianne Dudley. Aye. Lori Maley. Aye. Jonathan Whitman.
Yes. Minutes have been adopted. Going to honorary certificates.
The certificates are there, and I don't have any to really highlight, pretty typical one.
So we will move on then to Indiana Department of Health, promise system update.
They did not submit any slides, so I do not know. I have not found out from them. I know the big things right now, I've been pushing Dr. Yazel myself as well, is statewide trauma and emergency medicine symposium, October 1st and 2nd. October 1st is standard conference with presentations. October 2nd is actual hands-on sessions, kind of workshops. And so if you're interested, there's a QR code, but registration deadline, I believe, is the 20th. I think I saw an email. So if you've not signed up and would like to, please make sure that you do so.
Any further question or comment? Hearing none. Legislative update, Kurt.
No legislative update per se, because we have legislative session coming up in January will be short session. And so it is not a budget year. We have not announced our IDHS initiatives, but we don't anticipate a major initiative coming out of EMS this year. And that's all I have legislative. We have a few updates on other legislation later in the meeting.
Questions for Dr. Kenny? Hearing none. Moving on to EMS for children.
Barbara could not be here today. She had a conflicting meeting. She did submit slides. She did on this first one. There's also a QR code there. There is the Midwest Emergency Services for Children Pre-Hospital Pediatric Symposium. If you have not participated in this, I have done it, I think, 3 or 4 years now. There's usually at least one speaker from Indiana, but it is very engaging. It's good information. And if you need a continuing education in pediatrics, I would encourage you to look at that. The other one, which I will show some snapshots later, is Margo has been encouraging our staff, and our staff has reissued the pediatric incident data report, which was something we had 2 of them with Dr. Kaufman, and then we had some challenges with data, and we were happy to reissue that this year. So I'll have more information during my review. Those were her 2 updates.
Move on to Indiana Fire Chiefs Association EMS Division Chiefs.
Nothing further to add except for besides Ferrari's welcome and also congratulations to Chief McCullough on his upcoming year. And also, good luck, enjoy the conference. If you get a chance to stay, listen to some lectures today, tomorrow. Have a good day.
Thank you. Indiana Emergency Medical Services Association.
Well, just so everybody's aware, the conference is in full bore planning mode right now. Registrations are open, speakers have been set. November 19th in French Lick, Indiana will be the pre-conference. A lot of good stuff with pre-conference. There's a big discussion. Nate's got a pre-conference on MIH and incorporating AI and things like that. So we really need to be there for the MIH program. Encourage your people to attend that program. It's going to be a really good day with some breakout sessions involved and other things in vegetation. A lot of great speakers. The CADS class, Certified Illness Documentation Specialist class, that's going to be there as well. You'll be able to take a national certification test at the end of that. There's going to be the hand typing instructors class that's funded again through the state. It's a forensic SANE class for EMS and nursing on how to testify and how to deal with those issues as well. And other things that are going on down there for the pre-conference. And then we have 4 or 5 tracks running for the conference on the 20th and 21st. All kinds of education from leadership to clinical to community paramedicine to mental health. If you're a nurse practitioner or a physician assistant and you need hours for your continuing education, we have classes that are being taught by the doctors and the PAs that are continuing education available for those people. One of the things we heard was the NPs and PAs can't find education. So we added a component of that this year, so they can get their education and get their hours. The mixer on Thursday night is gonna be the Roaring Twenties. So dress up, reminder, please no Tommy guns or guns. We do not want casino security to have to make a tough decision. We do value all of your attendance. Make it a point to be there. Early registrations are open. Hotel, we have plenty of rooms left for that. If you sign up online for the hotel, until I get a warning, when you open it up and you see $800 a night for rooms, it's because they have it at the West Bay and it's not under our discount. Make sure you put in the right dates and that you want to stay for the conference and you'll get the right rate, the right hotel. I had 2 calls this morning, a little bit panicked when they saw the rates for the hotel. Other than that, meals were covered, breakfast with vendors on Friday. If you have a team that wants to compete in the Governor's Cup, that's going to be advertised very shortly. Again, 3 levels again this year: EMT paramedic, and then your critical care component, which can be 2 paramedics or a paramedic and nurse. But we're doing all the testing right down in French Lick on Wednesday, the 19th, and awarding winners in each category. So IndianaENA.org is the sign up for the conference. You'll see all the information there. IndianaEMSAssociation.org for vendors. If you know vendors that want to participate, we've got a lot of good vendors this year again. Reach out if you have any questions. And I think that's pretty much what we have to cover. So thank you for your time.
We had a question online, and I think when I checked, I didn't see. I know you guys just notified all the speakers. Do you have the times and agenda online, or when do you think that'll happen?
That'll be coming out shortly. We still had a couple of speakers who had not turned in their intent to present as of yet. So we didn't want to post the agenda and then have to readjust it. So as soon as those couple last couple handfuls actually do their intent to present, it'll come out. So
Thank you.
thank you.
Any questions for the Indiana EMS Association? Hearing none. We will move on to the Education Oversight Committee, Commissioner Son.
Good afternoon. So we have our first meeting scheduled for October the 9th, Thursday at 10 a.m. at the Townsburg Fire Court. And we'll be sending out that invitation
I
to.
just sent it out and I put to be determined. I haven't heard back from Zach Powers. It'll probably either be at the. Or, oh. Yeah. Right. So the 9th at Brownsburg. Okay, I will send that other email out now.
So we'll have a formal report at the next meeting.
Thank you very much. Full Integrated Health Committee, Director Kim.
First of all, you gotta bear with me on a lot of stuff today because we have staff everywhere. Emily is off. She is having a surgery. She did broke her foot, so she is not present today. So Jennifer is filling in as the secretary, which we appreciate. That means you get to hear me for all the MIH updates. So we did meet on Friday, August the 8th. Our next meeting is Friday, October 10th. We spent most of our time there reviewing the programs we're getting ready to go over. But we also did talk a little bit about the MIH opportunities at the Crossroads Conference in French Lick. And the Emily and Corey still continue to update the MIH program information that's available in our map and otherwise. So if you have not completed that, please reach out to them or they will be reaching out to you. So we make sure that information is accurate. We did have applications for MIH approval and we have recommendations for approval here. And we actually had 3 this month and you can see with the map there, some of you can see, sorry, it's not the best layout for us, but we are getting to the point where almost every county has a program, which is great. So this month we are recommending approval for Columbus Regional Hospital, Highlander Fire Protection District, and Ohio County Rescue. Starting with Columbus Regional Hospital, located in District 8, covers Bartholomew County. Their focus will be on hospital dismissal, post-discharge follow-up, and readmission prevention. Post-response follow-up for certain emergencies such as diabetic or overdose, chronic disease management, and decreased utilization by high-frequency patients. Broader goals program, decrease hospital readmissions, follow-up care for post-discharge, and decrease the number of repeat responses. Providers will be required to meet all hospital assigned education and training. No additional training is required at this time while they are developing their program. Is there anyone online or in here that would like to say anything further on the Columbus Regional Hospital application? And I believe all three, if I recall correctly, it's been a little bit of time. I think all three did speak when we approved the programs, so. Highlander are voted to recommend approval, I should say. Highlander Fire Protection District, located in District 9, covering Floyd County. They have a list of them. I'm not going to read all of them in front of you, but everything from hospital dismissal to counseling programs, disease management, OB newborn management, and the like. The program's broad goals are increasing education and awareness of public health, decreasing overutilization of the 911 emergency system, hospital readmissions, and assisting with local doctors' visits for the vulnerable populations. Their education is to meet all fire department issued trainings and program trainings, and they intend to cover elder care, fall prevention, vaccinations, mental health awareness, and substance abuse. Is there anyone online or in person from Highlander Fire Protection District?
Yes, Captain Young from Highlander here.
Go ahead.
We have reached out to Baptist Floyd Hospital, and they are going to work hand in hand with us there. We also have reached out to Clark, to their mental health program, and we're going to get training through them as well. We also have a few registered nurses on our staff that are going to help carry forward our program.
Thank you. And knowing your county's location, I think that's going to be a big win for that area. The final one we have for consideration is Ohio County Rescue, and that is located in District 9, and it covers hospital dismissals, post-discharge, post-response follow-up for certain emergencies, diabetic counseling monitoring, chronic disease management, decreased utilization, and elderly management programs. Their broad goal is to reduce hospital readmission by providing patients access to health and support services that would not otherwise be available without a hospital admission, to reduce the overuse of EMS services for non-emergency and non-transport purposes by providing patients access to those services without compromising EMS coverage, to provide patients with improved access to healthcare by bringing health services to the patient in lieu of requiring them to find a method to access those services otherwise, to improve overall patient outcomes, to promote long-term quality of life by providing a patient-centered approach to healthcare, to improve overall community quality of life by tackling issues such as chronic disease management, public health, and aging-related patients. Their education platform is they will be required to meet all department and issued trainings with additional trainings in chronic disease management and patient encounters. Do we have anyone in person or online from Ohio County Rescue? After consideration of all three, the Mobile Integrated Health Advisory Committee is recommending that the EMS Commission approve the MIH programs for Columbus Regional Hospital, Highlander Fire Protection District, and Ohio County Rescue. Motion to approve.
Second.
Second. Any further discussion? Have a roll call vote, please.
Lee Turpin,
Aye.
Darren Hoggett,
Aye.
Dr. Lisa Klein,
Aye.
Patrick Hutchinson,
Aye.
Matthew Shady,
Aye.
Jerry Herder,
Aye.
John Zartman,
Aye.
Dr. Sarah Brown, Matthew McCullough,
Aye.
Andrew Bowman,
Aye.
Mary Ann Dudley, Lori Maley,
Aye.
Jonathan Whitman.
Aye.
All three have voted. Further discussion on MIH?
No, that completes my report on MIH unless there's any questions.
Okay. Moving on to new business.
The only item that we have as new business is we did map out, and it usually is subject to availability of rooms out at May for most of our meetings. But we also do have to balance like different conferences. We tried to pick the second Friday of the month, but if there was a national conference on that Friday, then we did adapt it. And so those are the dates that we have. And we also did include the MIH committee dates as well. We can advertise those. Traditionally, we have scheduled it, if the commission would like to adopt them, then they may do so as well. And then Emily will send out calendar invites as well.
Going on to old business, traffic incident management presentation. Kenny, Amanda.
We actually switched it slightly. It's correct on the slide. We had a productive meeting. They did reach out, Amanda and Danny with Matlock, excuse me. We had worked with Danny in developing the state program that we've put in ACADIS. I know we're still investigating some pickups where the programs are halting. But they had reached out to us on collaboration and such. And we had very productive meetings, some exciting exchange of information and trying to align both their goals with our goals of protecting EMS. And so we invited them to come before the EMS Commission. And with that, then I will ask to bring up Danny Matlock from NDOT, who will give us an overview of TIP.
Thank you. First of all, I'd like to thank the commission for making this training now mandatory. You're the first in the state of Indiana to do so for any of our disciplines. I was in this position for about 5 months when IDHS reached out to us to come up with a plan on how we can capture this data with the federal highway, but also now with Indiana and attaching it to the certification so that we would have the process for that. So for about the last 8 months, we've been working on the kinks and having meetings to try to figure out how we can get this. And I think we finally have ironed it out a little bit. It's going to start running a lot smoother. We could do the next slide, please. So we have the 3 available options here in Indiana that the commission approved for the training. We have 2 online options. The National Highway Institute has one, and then we developed one and put it into the ACADIS portal. If you take the ACADIS portal one, it automatically will attach it to your PSID, and you will have that on there. If you take the Highway Institute one, you will have to print that certificate off and submit that to the EMS Commission through their proper channels to have that attached. But the number one is the in-person training. We at Indiana Tim would rather come out and teach you all the traffic incident management than have you sit online and do it. And a couple reasons for that. We have a conversation. We get to sit in a room. We have a multidisciplinary class where we bring fire, police, EMS, towing, all the key players who are going to mitigate a traffic incident, right? So we want to sit in a room. We want to have them talks. We want to have them experiences so that we can communicate a little better and achieve that goal. Next, please. Just a little brief summary of why TIM training is important. The number one is responder safety. We want everyone to go home at the end of the day. I've spent 19 years as a firefighter and EMS. I also worked for NDOT. So I have managed many traffic incidents and have had firsthand experience of how dangerous it can be out there. A big thing for NDOT is we want to prevent them secondary crashes from happening. If we have the safe quick clearance approach, We're all coordinating together, working together to get in and out of our seats as quickly and safely as possible. We're gonna lower that risk of having that secondary crash. And when we look at that data, our secondary crashes are usually our fatalities. Usually a lot bigger than our primary incident we're at. And then sometimes it reflects a responder on scene that has been struck. So we want to try to prevent them as much as possible. We want to improve communication between interagencies so that everyone knows what their role is and how we can communicate and achieve that goal of safe, quick clearance. Because one of the biggest things we see when we look at traffic incident management is when does all of our responders get in a room together and talk about anything? We don't do it. Not until we're on the scene of an incident, we got trucks flying by at 70, 80 miles an hour. We're trying to figure out how we're going to manage this. So by being able to get in that training and having that conversation, we're working towards that, right? And then we want to clear the road as fast as possible. We want to mitigate them scenes, save time and money, and get traffic report back to normal flow. So that's just kind of a breakdown of why we do TIM training. And when we go to other states, Florida, for an example, Georgia, Virginia, they have very aggressive TIM programs in their states. It works. When you look at their state's data, their responders, struck bys and near misses are lower than the rest of the nation because they have an aggressive program. Next, please. So this is just some key benefits of why we promote the in-person training. I've hit a couple of them. We will come to your agency and do the training. All of our instructors are responders, so we're not sending you an engineer or someone who's never worked this job or have anything to do with that. We're sending you responders that are going to come out to you and talk to you about this. We're going to engage and have discussions about responder safety, have a deep understanding of the material, best practices that are going out there, how we position our trucks. I go to so many fire departments and they'll park right on top of the incident. We're going to talk about putting that safety net in there, having that buffer zone, how you angle your truck. All that stuff will come with this training. The tabletop scenario, so you won't get that online, but in person, at the end of the course, we're going to set up tabletops and we're going to break them into teams. We're going to get our big maps out. We got our little Hot Wheel cars, but we're going to have scenarios, incidents. We're going to set up zones with little traffic cones, all that stuff so that we can talk about incidents and see, have a better understanding of what we're dealing with. And it's no cost. It doesn't cost you anything to have us come out and teach you. Next, please. This is just a little breakdown. If you want us to come out and provide this training free of cost in person, you can email us at indianatim@ndot.iu.gov. Just give us a date, time, and location. We need to kind of know the room capacity because we want to have that multidisciplinary course, right? We want to invite the towers. We want to invite law enforcement. We want to invite the fire department. Anyone who's playing a key role in that. Dispatchers, we don't realize that they play a huge role in traffic incident management. So we want to get all the key players in there. Give us at least about a 4-week notice so that we can get that out there, advertise it. And then what we will do is we'll schedule that course. We'll put it, so now we have the options of putting it in a cadence. So now we can deploy that out there so that it's all in there. All of our responders can log in and register for that course. And then once you complete the in-person, we'll submit a final report and it will automatically attach to your PSID number that way as well. And then of course we'll promote that, we'll do all that good things and try to get that class as maxed out as we can and get all the key players in there. So that is my email address and the program administrator's email address. You can also email either one of us. The QR code will take you to NDOT's Traffic Incident Management website where you can follow us on social media. Sign up for our distribution list where we send out our TIM newsletters, but also the big thing is all of our TIM classes are distributed that way. So if we're having a TIM course in one of your counties, that is a good way to see that it's happening. Any questions for me? No. I will leave some brochures with all our contact information. If you all would have an in-person class or an agency that would, please reach out to us. And again, thank everyone you all for making TIM training priority. Thank you.
I'll just follow that and know I took the instructor course under Danny and Amanda last month. And there's not too many classes that I've been through where practically every minute had something in it that was usable, that you could apply to either something you had before, something you're going that you know you're going to see in the future. It was time well spent in both the online course and the instructor course both. So my compliments, very well done. We can move on to mental health and well-being, mandatory education, very good.
So, as you recall, 2023 House Enrolled Act, 1321 added that there has to be certain requirements both for initial education as well as renewals that focus on mental health and wellness education and opportunities so that our responders, and that targeted both EMS, fire, and law enforcement, all three, and said that they have to have the items. What we have to do is the initial education, and then every certification cycle, individuals have to make sure they have that training. And when we introduced it, we worked with the IDHS Fire and Public Safety Academy. We developed LMS training, 3 courses that met the 3 main components that the statute requires. And when we approved this back in March, we asked the commission for ease of tracking, let's make every responder take all 3 in a cadence, so that way we have a clear record that everyone has taken it. We have had some questions because the Fire and Public Safety Academy approach on the fire side, some of their certs, so their higher certs are starting to have expiration dates, but like your basic firefighters don't have an expiration date, so they don't have a continuing ed requirement. Their statutory responsibility is on the organization, not the individual. And so a lot of the organizations, they can require a CADIS, but they can elect to have their own education. There's a lot of quality education in this area. And so what we did was we went through, and I think Carrie, as our education section chief, she went through all 3, and we do have some guidelines in the written materials that were emailed out. But we're essentially asking the approval of the commission to back off the requirement that everyone has to take the ACADIS offering. And if the department will submit a roster through the format that we develop at IDHS, then we will give the people credit so we can track. We were consulted early on. Alyssa Schrader, our legislative director, met Dr. Yazel and I and Marshall. And the bill author, I know her intent is to make sure people have exposure. I honestly think she would prefer a live person offering. And so I think this is a positive, although it may relax a little bit on our ability to guarantee that everyone has that training. But if the procedures are followed correctly and they submit the course and the course attendance, then they should be entered into a CADIS, and then we'll be able to do tracking that way. So that would be our request to the commission, would be to slightly modify what we approved in March to still meet the statutory requirements, but allow for another means. And I did consult with our counsel, Sean Wooding, and we were basically determined that the language was not required that it be a virtual option. This says it's one of the options. So it would be permissible to do.
Pleasure of the question.
I move that we have the option to make those trainings available. A multitude of formats. So if we want to leave it open, we can leave it open.
Second. Motion and second, leave it open to multiple training formats. Any further discussion?
I just want to clarify for the record, if I can, when we created the guidelines, we don't view that as a check sheet either. That is, if someone wants to develop a program, they can look at what currently exists and develops theirs. But if someone submits a course, we aren't going to say you left out this or you left out that. They are guidelines, not an approved curriculum per se.
Any further comments or discussion? We roll call vote. please.
Reed Turpin,
Aye.
Darren Hackett,
Aye.
Dr. Lisa Kleine,
Aye.
Patrick Hutchinson,
Aye.
Matthew Shady.
Aye.
Jerry Harder.
Aye.
Don Zartman,
Aye.
Dr. Sarah Brown,
Aye.
Matthew McCullough,
Aye.
Andrew Bowman,
Aye.
Mary Ann Dudley,
Aye.
Lori Bailey,
Aye.
and Jonathan Whitman.
Aye. Motion passes. Administrative proceeding.
I'll get the right number.
There's no action item. I will just highlight as an update. So with the administrative rulemaking, I'd like to give an update. We had a great meeting with Sean, our general counsel, Justin Goodell, and we went through with the section heads and I kind of where the governor's directives are in terms of rulemaking. So the draft that you have will probably change some and we will come back. If we can't change it, you would have to change it. But we're trying to create a document that we believe would be acceptable, would streamline the rules, but get the changes that people want. And so that'll probably take some time. We were discussing, we would like to do it by the end of the year. That may be a little ambitious, but we are hopeful that we can get back with a draft rule. And it may be actually all the EMS rules instead of just Article 4. So I think it could be a positive. We feel pretty satisfied that we're going to be able to come up with something that will convince the director and the governor's office to approve with a streamlined set of rules. For the appeals docket, we did have one successful. The appeal was not successful. We were upheld. We had a decision where we denied an individual that had picked up a series of felonies. And we ended up denying his application. And he did request a hearing and the ALJ found that it was within our discretion and denied his certification. In those, just for general knowledge, we had indicated in our denial when he would be eligible based on, we understand there's sometimes rehabilitation, but particularly if it's a felony, we need a certain amount of time to show that rehabilitation and that appeal affirm that action. So Zachary Mays will come off of the appeals docket because that one has been resolved with the agency action sustained in that. Keener Township respondents, that one still is pending as an appeal. That's all I have on the administrative proceeding.
Okay. We are now at staff reports. David.
Robin Stump is over in Illinois. I'd asked her and Corey are both attending the National Association of Stadium S officials regional in-person meeting. They scheduled it. I had suggested they not schedule it since I knew we would be busy here, but they elected to schedule it during this week. So I am not attending this year, but both Corey and Robin are there, but we have Jason that is going to do that for both the data and the operations report. Maybe.
Got slides? Awesome. All right, so I apologize, as Director Kenny said, Robin's off representing the agency in our state at the NCMSO meeting, so you have to deal with me. She'll be back next time I will. So, first slide here, she's also provided me with notes, so this will be. First slide here, as you see, we're having some reports fail on the import as they're imported to FEMA. So we received partner. Those go to FEMA. We're working with them to figure out the issue. We've also had our image trend migrate to more secure internal networks last week. We found a couple of issues with report writer we're still working on, but everything seems to be okay. Next slide. Good control.
I'm sorry.
Next, I'm sorry. The EMS reporting percentage is a continuous target. I love how she phrased that. We've got, provider organizations that are changing vendors. So if you're utilizing, Image Trend and you switch to use ESO, that's something that we need to know about. The vendors do their thing on their part, on their end normally. We need to know about that so that we can have you switch to, in the case I pointed out, over to the ESO integration account. So I personally have a provider that switched June 1st. Everything's rocking and rolling on their end, everything's rocking and rolling on the ESO end, but they didn't tell us. So at the end of May, we stopped getting reports from them until we got them into the integration account for ESO and started getting their stuff. So please, make sure if you're moving vendors, changing vendors, that the vendor reaches out to us and so that we can add you to that integration account for that particular vendor. Next slide. She said just wanted to give one of the reports we generated for the dispatch newsletter. Everybody that's certified or licensed should be getting that. It's sent to whatever your email address is in Acatus. So should be getting that newsletter. This is one of the reports that was generated for that newsletter. We've come up, she said, we came up with around 25 reports. We'll be adding a different few to each newsletter as it comes out. So next slide. Maybe it's, hey, there you go. I didn't know that it was flowing right into that. She didn't have any notes about there. So this is our current totals of provider organizations. Staff working continuously still put all organizations and vehicles into Acatus. So as hopefully most of you, maybe all of you know, the end target is for all those renewals to be processed in through Acatus. So you're not printing out papers, hand carrying papers to medical directors and all that stuff and having to sign that stuff. It will all be done electronically. That involves us migrating everything from the old Oracle database over into Acatus. I would say a lot of it's done. There's still a lot that needs to be moved over. I'm trying to get those done prior to renewal cycles so that people can start renewing electronically. If anyone needs help with any of that, any questions about that, please contact your district. Any questions about either report? Maybe I can stumble over on answer. That's awesome. She perfect notes, no questions. She rocks. That was all right. I don't have Corey's to. I don't have anything for Corey. I was not saying anything about him, so.
That is me, and he did not.
Very good.
But hopefully I know. So, the one thing he wanted to caution, we had a discussion, sometimes when I used to do these, I would not put data that was early. He went ahead and put the to-date data, but remember, we're in the middle of a quarter. So that's hence the red at the bottom is that these numbers will fluctuate because we always get that rush. If you have an expiration coming up at the end of the month, this is your clue to go ahead and do that. So that's a good reminder, people. But right now, everything seems on track for a standard renewal. We are still increasing. Currently, when he ran this, we are now over 26,000 clinicians. And if you remember, for literally 5 or 6 years, we were 24.5. And so we went up to 25.5 at the beginning of this year, or excuse me, a flat 25,000, excuse me. And we've been in that range and we just hit 26,000. So the numbers are looking good there. Certifications, audits listed there, we have had 110. We still issue a fair number of sanctions for people that audited inappropriately. So please make sure to educate if you are having sessions with your staff. So that way they understand the importance of having their records ready, making sure they're accurate and that they are eligible to renew. Violation statements, we still do way too many of these. When I fill in, when Corey is off, I'm always pulling my hair out because he was off for 2 weeks in June. And I think I processed like 25 violations that came in. And I guess maybe that's not bad for 25,000 people, but still, it just seems like a lot. And so we do take actions on some we have further information requested. We just did a few that just happened recently. PSID processing, and we asked the people requesting PSID do it. We ask that you don't do it on behalf of someone else. Occasionally, we still get that where someone says, I do this on behalf of my employees or whatever, particularly with the PSIDs, because it's tied to their email and everything. It is important that initial application be done by the actual person. Once it is requested, Jennifer runs those down, and usually 24 to 48 business hours after that. Usually the next day she's in the office, she gets those ran. And so if there is a delay, you can always check that. Unfortunately, we do still have a strange loop between ACADAs, where some of the email accounts, you may not get your introductory welcome. So the person actually has an ACADA's account, but was never received notification that it was active. Individual certifications and licensing processing time is still averaging 1 business day. So I always have applauded, will continue to applaud the work of Jennifer, Corey, that as they process all of those and get a very timely response. Unless there are any questions, that's all the certifications report.
Out of the way. You go to the next slide. Okay, go back. All right. So, the EMS Commission did approve the, did approve the, primary instructor, updates. Primary instructor, you have 12 adult education hours that you're required to get. And of course, attending the PI forum, mandatory PI forums, one of those will give you automatically 3 hours. Or no, 3 hours. So you can use that 3 hours. And what we're gonna do is we still have, and I have a slide of the upcoming PI forums that are still coming up. But our goal is to catch the people that maybe could not attend for various reasons. Any of the in-person ones, we are going to put one in ACADAS that you will take. There'll be probably a little quiz at the end to verify that you did it. And then after, that'll probably be in December, so that would be qualifications. Instructors not completing either an in-person one or the online one by January 1st cannot teach an EMS class or be involved in teaching an EMS course until that's been taken. So make sure you're catching one of those. And the next slide will show you the, it's hard to see with the dark colors, but on the right-hand side of the pie chart, you'll see the attendance of the PI forums that we have already had. We've had fantastic attendance ranging from, you know, a low 58 all the way, or 42 all the way up to 92. So we are finally just a smidge under the halfway mark of getting all of our certified PI personnel in the state to attend one of these forums. So be on the lookout. Going to the next slide. Here are the upcoming mandatory PI forums. The next one will be next week in Terre Haute, followed by September 30th in Richmond, October 3rd in Corydon at the Harrison County Hospital, October 7th, Wabash, Indiana, October 14th. We got an evening one there in Southeastern, or in Versailles at the Southeastern Career Center. And then October 17th, we have one in Vincent. So we still have quite a few more to go, but we've done a really good job of capturing, like I said, just about half of the PIs. All right, so we've been working with the group Delineate, and they are helping us pull some data. And one of the things that they asked for is they wanted me to go through and pull stats for all the EMT levels for the past 5 years. So from 2020 to present day, which was September 4th when I ran it with the National Registry. So it was kind of fun to see how many students have gone through. And so what we did is I divided it up into first attempt, third attempt, and the cumulative sixth attempt. So if you look at the cumulative sixth attempts for each level, that is going to tell you, if you add up the pass and fail, how many students actually took the National Registry. For the sake of the slide, we went ahead and just put data from the first attempt. So we had a first attempt pass rate for those 5 years at the EMT level was about 62%. The national was 71% or almost 72%. So we average usually about 10% below the national rate. And for the fail rate, we had about 37, almost 38% fail, 28% was the national fail rate. But cumulatively, for the sixth attempt, we had a pass rate of 85.51%. The national level, we had cumulative 79%, national was 85, so again, we're a little bit below that. You can go ahead and go to the advanced slide. And then at the advanced EMT level, which we always seem to do pretty well, we're pretty close to the national average, but for the first attempt, we were at, for those 5 years, at about 65% pass rate, 38.5% fail rate. National average was just slightly different, so we were pretty on par with national average. The sixth attempt, we had a cumulative sixth attempt, 82.99, so basically an 83% pass rate and a 17% fail rate. So overall, we were just slightly above the national average. So we're doing pretty good at the advanced EMT level. Next slide. Arithmetic levels. So for the first attempt, usually we're pretty much right on par with national. We fell a little bit below for the first attempt pass rate, which was 69, a little over 69%. Fail rate of about 31%. National is about 74% and fail rate is 25. So overall though, we usually again do pretty good. So for the cumulative sixth attempts pass rate, we had 93, just over 93% pass and 6%, 6.5%, I'm sorry, 92, about 92% pass, 8.3% failed. Overall, we are just slightly behind the national average for passing. So at the paramedic level, we've always done pretty well. So the bad news is when you bring up, this is something you can find on the National Register website on their dashboard for the year 2024, so for last year, we are ranked fourth from the bottom at the EMT level for pass rates. Our pass rates in general are at about 70%, which puts us 47th on the list. So I think Craig said that we maybe bumped up one, we were third from the bottom, and now we're maybe fourth from the bottom. But this is really something that our instructors are gonna need to start focusing on, hopefully with the use of the JP Learning Test Prep that we have instituted as of July 1st for those classes that started after July 1st. Hopefully it will help. But this is really something we need to focus on, trying to get our pass rates up at this level. I think that might be it. Another slide. That's it.
The medic one. So the medic one, not medic.
Okay. Oh, there we go. It looked identical. So medic one, so Indiana was the 30th in the nation. So that's far better than what our EMT level is. You know, overall, I think part of that has to do with accreditation. Having those higher standards, I think, does make a difference at the paramedic level. Don't forget, there is a voluntary COAMS accreditation that you can do for the advanced level. It's nothing that is mandatory, but it is there. So that might be something your institution might want to look at doing. I think now that last year. I hope I like. PI quarterly update. So we just had, last week, we just had our third quarter. Fourth quarter PI update will be held in December. We got a morning session on December 9th, 9 to 10:30 a.m. Eastern time. And then the next day on the 10th, we will have a it's evening session from 5 to 6:30 p.m. And what's exciting is Brett Schnepp from Lifeline EMS, he and I were actually down at the COAMS, or not the COAMS, the Nancy Symposium in Orlando together. And we were talking about AI, and he wanted to put together a AI presentation about AI, using it in the classroom. So he will be a guest speaker for both those sessions. And I will send out Teams invites probably in November. So you go ahead and mark your calendar. And then we'll be coming out with the dates for 2026. And I encourage, if you want to spotlight your program, or you want to do any type of guest speaking, please get a hold of me. Helen?
Okay,
Yeah.
I didn't see it on your calendar. Is the pre-conference with the NREMT also gonna be,
Forgot about that.
that's gonna have, the instructor update as well, correct?
There will be, yes, so there is a pre-conference, I think it's $50 is the registration fee. And there's going to be two things. One, there is going to be like an instructor update, which is I think 3 hours long, 3 hours long. And that's just kind of what they did when they were here, when National Registry was here for FDIC. They're kind of just going to give kind of an update to our instructor. The other one is actually you can participate in basically a mini session where you can do like it's a scenario panel discussion, where basically they kind of teach you, if you were to go and be on one of the panels to learn how to evaluate questions for the exam, it's going to be like a mini version of that. So that's going to be real exciting to bring. And yes.
I think some people are thinking that the PI instructor update is gonna be part of that as well, because I've heard a couple people talking about
It
this.
is, because that's split on 2 days. The registry is doing half of theirs on the pre-conference.
Yeah.
And then I believe they were approved for a conference on Thursday
Which
to
is
do
part
the
of
other
the-
part.
yeah.
And so I think our update would follow the registries on the Wednesday.
Okay, I just wanna make sure how it was being advertised, what people were thinking was correct, so.
Yeah. So are we doing a
Yeah,
PI for?
Yeah, we're gonna do a forum thing.
Okay.
Yeah, we're doing on top of it.
I'm just
Yeah.
glad, I'm glad we discussed that. Yeah, okay. Well, there'll be another PI core in there then.
Just curious, in the NREMT board that shows those, do they provide other statistics for context with those?
Do they
Or
provide
do they
that?
just give the percentages?
I think it's just the percentage down your
This is
way.
pretty much what you can see. I can run different things like the first level and stuff. And there are other reports, but none of them were really on point to this. I'm trying to remember what they were.
We can run reports based on individual,
Because I think counts are always an important contextual piece of data when you're looking at just percentages.
yeah. And that's why we do try to provide, because we can run first pass rate, third pass rate, sixth. And I think in general, we typically look at the third pass rate because we feel that is a more accurate statistic to look at. It's more fair. But yeah, we can look at the state as a whole, we can look at the nation, and we can look at individual programs. But the data can be different depending on the time frame that you're running.
Does it drill out the high school programs?
It does not.
Because that
Yeah.
could skew a lot of the percentages to the
But-
ERC.
However, it's only looking at the students that have taken the test. So you may have a high school program, and this is data we're hoping now that we've separated the high school classes, we can
Yeah.
pull this data better. But it's only based upon who has taken the exam. So it's not looking at how many students were in that course, it's just who signed up to take the exam.
And the other thing to that is always one of my concerns is always the cost of the registry being so high that you get entry level, $10 an hour person that's gonna go take that exam, takes it the first time, fails that exam, says, I am not paying that again, that $104.
Well, we have a possible solution.
I know you guys do, and that would be awesome, but
We are still, there still is a chance it could get rejected because it has to go through quite an approval process. But National Registry and our fiscal and it was Corey and I met online, and it looks like the contract is pretty solid. There are a couple minor changes, but again, once those two parties approve it, it has to go up all the way through the Attorney General's office. So there is still a chance that it could get zapped, but we're hoping not.
that's the one thing with the registry, I always wish they would, if you get assigned a number, then you're that number, you're not a new student when you test the second time, so now your percentages could be varied after fail the first attempt, because that student did not take the second attempt. And now your number's getting smaller because the next student's gonna do the same thing. So
Right.
to me, I would love to see more of a breakout where there would be like student A, follow student A through third attempt, fifth attempt, instead of being.
Yeah. One thing we're doing with the students that do sign up to do the JV learning, the student driven and the instructor driven is we are now going to go back and look to see at what attempt did they pass or did they ever pass the national registry. So we will have a little more data for you as far as that.
That's a nice,
That's a little better.
because that correlation of what they passed, what was their final score of classroom and attempt
Right.
on their cumulative attempt would be
Yeah.
nice to know.
Jen, did you have a question?
Yeah, so was there any specific reason why we looked at the last 5 years? And I only say that because that includes the COVID years. And accreditation doesn't even hold us accountable for some of those COVID years.
You know,
Testing and the
yeah.
binding of the education was so difficult.
You know, I honestly have no idea. That's something that we could reach out to Delineate to ask them why they wanted those 5 years. They asked and I said, okay, I'll pull it. But honestly, I don't know why they chose 5 years, but that is a really good point. So that is something that we may bring up with them and see if we can pin down why they wanted 5 years. Why not 3 years?
Yes, plus we've seen such an increase.
Sure.
I'm like individually, we've seen increases with change in the test.
Yeah.
So I
Yeah.
think those would be really great parameters to look at. What are we now that has changed? The COVID years, here's the information, but we know that we people to it and get all insane, scared about numbers from years that athletic means all.
Yeah, we'll reach out to them and find out. That's a great point. Thank you.
I think I can answer part of that. I may be at fault for that. I think we have so many projects that they are evaluating. I recall the meeting and they're like, hey, let's do a snapshot. Do you want like 1 year? And I'm like, let's do several years. And they said 5, and I didn't really think about the whole COVID thing.
Forgot about it.
So I think they can adjust that pretty easily. I think they'd be open to that.
I just figure since I ran those numbers for them that, we might bring it up at the, PI forums and also in this setting, just because I had the information. So, but great point.
Any further questions for Karen? Hearing none, City Master Director's report, Director King.
Thank you. The first thing I have is most of you probably know, just want to make sure we have a new director for the agency, and you should be familiar because he's sitting up here. I'd like to recognize Jonathan with him. And he started off September 5th, so we're excited. I think he recognized as our former general counsel and then chief of staff for years. I don't know if you want to add anything, Jonathan.
No, I'm still the dumbest in the room, so I am excited to continue to learn from all of you and be in this position, but been in public safety for about around public safety, I guess, for about 24 years and with IDHS for 11. So I think the message the last few days and last week was we're ready to get back to work. Had some distractions here recently, and we've got a great group at IDHS, and we all we support you, and we've got your back, and just want you to know that we're ready to kind of rock and roll, get some things moving forward. So I'm glad to be here. Thanks for that.
I think the only other thing, we do have a new secretary of public safety, and that is the state police superintendent. And so he will stay with his agency, whereas Secretary Green was both the secretary and IDHS, and now we will have Jonathan as our agency head. The EMS dispatch, still a good source of information. I did think of that when Danny was here from NDOT. One of the cool things, they gave us a tour of those interesting insurance trucks for the breakdowns and stuff. And Corey and I'm like, this is really fascinating. I had no idea what all they carry. They carry tourniquets, things like that. But they have different capabilities and they can also change their signboards and things like that. And so I think that is an example. I told Corey is following up with them. I'm like, let's do a newsletter spotlight on that, because I think a lot of people might be interested to hear what they actually do and what they cannot. I honestly, I didn't realize they had equipment. You know, I knew they helped with tire, but they have belts, they have all sorts of things on those trucks. So just the teaser, EMS dispatching goes to everyone certified. If you're not getting it, check your junk email folder. You can sign up for it individually if for some reason you don't have it or want it on another email. There is a subscriptions tab on the IDHS website. We referenced earlier the 2024 pediatric incident data report. And I owe Monica Bolstetti was our intern, and she's a contractor briefly for us, potentially longer. I think she's interested in a regular position. Kim Foster is now on long-term disability leave, and we do not know if he will be back or not. And so it is still Robin is your data contact, but Monica is doing great things. And she worked with Corey. Margot was pushing him from EMSC and said, can we please resurrect this report? And between them, they came up with the 2024 report. It includes things like total pediatric incidents, number of incidents by age, number of incidents by county, incidents by month. I have a few snapshots here, like the primary symptoms you see versus the primary dispatch complaints. This is all on our website. And there's more information that's there, like cardiac arrest numbers, stuff. So it's a great pediatric report. I encourage you to look at it. You can find it under our data section on the website that tells you the link or how to get there if you manually go there. If you have problems getting it, reach out to any of the staff members. We can get you a copy as well. But I think it's a very valuable report. And I want to thank the staff for taking the time and working with Emergency Services for Children to make sure we get this report done. Health First, EMS readiness, we are on fiscal year 26. I label them as multiple years, but because they overlap again, July, and it will go through June of next year as fiscal year 26. So we have 4.1 million total. We do have different projects. Carrie referenced the National Registry, the JBL Learning platform is continuing. And the two new ones that we have this year is we do have a mobile integrated health, the IDHS EMS companion grant. Why it's a little bit longer, and I wanted to tell the commission, if you recall on my legislative update, they did not fund the grant that exists in statute for MIH for new programs. And when that was not funded due to budget year cuts, then we don't have the availability, but we do have EMS readiness, and it can be spent on mobile integrated health. So we did consider whether to transfer the money, but that was becoming challenging to transfer out of one fund to another. So instead, we are offering the IDHS version of it. Most of it will be the same for you guys. The big difference is the commission does not approve the notice of funding, nor does not approve the recipients. That will fall on the agency since it's out of EMS readiness. We will have a review session. So if there are people that are not applying that are interested in reviewing, we're always open to having people participate in that process so that we make sure we have a transparent and a process that is equally represented. Both the grants I'm going to talk about run the entire month of September, so they're active now. You can find information and the notice of funding opportunity on our webpage. We are targeting 500,000 for the MIH component. The second grant is a completely new one, and this would replace EMS training equipment we did before as a big component. For this cycle, we're going to focus on AEDs, and this will target the BLS non-transport organizations, which are largely the volunteer fire service. But if there's a BLS non-transport, they can apply for an AED. This grant is very unique because we have what we call a QPA, which is a quantitative purchase agreement through the Department of Administration, which means we use JMD Medical And it allows us to basically create a catalog and people can purchase an AED with our authorization and we get billed it, which saves a lot of hassle. Anyone around or remember the whole foggers from 2020?
Yeah.
Yeah. So that turned into a operational, be direct nightmare because it was state property, so we had to tag them. Then we had to fill out a distribution form. So by doing it this way, it is the property of them, we're just kind of being billed for it because it's an approved vendor. JMP does have a catalog, you can find that resource, and it's part of the notice of funding opportunity, but there's a number of AEDs. So if that department wants to match a Zoll or a Phillips or whatever version, they can do that, and they can probably find it there on JMB Medical. And so that is grant for up to $2,000 for state certified BLS non-transport. And so the one requirement we do have a little different is we want to make sure that particularly because we have issues with BLS non-transport submitting their image trend, fire and EMS reports, they do have to show they are current with that or catch up before we will issue any kind of authorization. So both of those are great opportunities. Look for them on our website. So updates from the national organizations, EMS Compact is still continuing. We do have a rulemaking going on. We are required to post those rules onto our website. So if you want to see them, you can find them on the IDHS. Actually, it's on the EMS Commission's webpage under the rulemaking. And so if you want to review it, you can. The bulk of the rules of this one is dealing with individuals that a state has flagged as restricted based on criminal backgrounds and whether they have a privilege to practice or not. And so typically what the rule is going to say is that you have a privilege to practice with an asterisk. Our council hasn't looked at it, but the Compacts Council has looked at it. And that is permissible, so that in Indiana, we say, hey, if you got this and we would not recognize it, then we do have a right to decline your privilege of practice here if it's something that we would not allow a normal person to do that. And so this rule is kind of the first step of doing that. If you have questions, be glad to discuss it with you, or Donnie Woodyard, our executive director, can discuss that. The SIMSO, as I said, we have Robin and Corey representing us at the Great Lakes Regional in-person meeting there in Springfield, Illinois. You will see both of them. They come back today, so they will be here the rest of the conference if you are, and you can find out how things went there. EMS World Expo, we are gearing up for that. I know I'm hearing a lot of positive, a lot of Indiana engagement. They do offer vendor space, so we don't have vendor space there from the EMS division and IDHS. And so we do encourage you to come say hi if you are there. We also are working heavily with NAMI HP, the Dr. Yeazel's on their board of directors. They are going to have kind of a highlight of Indiana providers, and many Indiana providers are either on panels or are introducing speakers, things like that. And so that's a good opportunity if you have MIH. The final conference I'll reference besides the current one, we do appreciate the fire chief's engagement, having the EMS commission. We also do have a booth here, and you can mingle with our staff in the Fire and Public Safety Academy. We're actually in the main corridor out that way, so it's easy to find us, and we will have people here on Friday during the exhibit hall hours. And so that's a good way to engage us here. We will have presence at the banquet. And then tomorrow afternoon, if you would like to hear more of myself, Marshall Jones and Director Witham, we will be at a IDHS highlights panel discussion. And so that's tomorrow afternoon if you are around and would like to participate. The last conference, the main one of the year besides the regional ones, is the Crossroads Emergency Conference. You heard about it earlier, the EMS Association, Emergency Nurses Association. IDHS is a sponsor, will be a vendor there. We also will be involved in a lot of the pre-conferences. So I encourage you to take a look. There's a lot of great education. I know they have tapped poor Dr. Yazel to present several times. I am presenting down there. You presented this, Lee is as well. So a bunch of people down there, but I encourage you to consider that. We are down there for our last meeting of the year, which I believe we have a correction on the bottom of the agenda. It's not the 17th, but it'll be November 19th, which is the Wednesday of that week. With that, that is my open to any question. As usual for the commissioners, I can send out a PDF of my slides as well.
Last is Chairman's report correction. I really don't have anything. Oh, sorry. Notes made here, March 19th.
On record, basically, I don't want to. Couple things I want to say thanks to the Fire Chiefs Association. I know a lot of work goes into this, so I appreciate all the support having us here and things like that. And looking forward to a great conference. Do have one item I wanted to bring up for kind of poll the commission for opinions on. No formal request from this service for action, but they reached out. At the advanced level, we do have approved IO access, and it's somewhat common practice to inject a small amount of lidocaine through that for pain control for the pain that from administering medications. Technically, if you're by the letter of the scope, that is out of scope. And they asked if that is your opinion on that. Wanted to pose that. It's kind of an interesting idea because there's a small amount, it's not enough to really be cardiovascularly active, and it helps with pain, so.
Honestly, thought we addressed that at the time, but maybe we missed that, but I thought we addressed it. I thought we could do that, so maybe we also missed that.
It is my opinion that I feel like we should. I think there's a little
think
bit
it's appropriate not to do the IO without that in the conscious, maybe in the unconscious patient, but not in the conscious patient.
That's kind of my take as well, but it's not in our caveats on the scope document, which we are revamping, so, that will hopefully become more easy to navigate in the future, but I definitely would like to include that unless there's strong opinions contrary.
Dr. Brown, do you have any thoughts on that?
Can we look at the scope document again and then vote at the time?
Absolutely. I have some things to bring next time on the advanced CMT as well, so that'll be good.
Absolutely. Okay, yeah, we'll table that and I'll look and see if I can find a precedent where we have discussed that before.
General consensus to table, is everyone okay with it? I thought we did.
Yeah, we can look up the minutes and try to see if we can have a deeper dive.
Table, take a look, so.
Number two, just to kind of close the loop, we did approve Aspen at the EMR level. I do have that educational module that I'll have up on ACADIS here very soon. One thing, no state in service in October. It is the same day as the Indiana Trauma Conference. So I'd like to make sure everybody's clear to be there, encourage attendance there and things like that. Looked at postponing it a week, but that runs into fall breaks and things. So decided just to hold off on October and start back up in November. Have some good speakers coming up, pediatric burns, some higher level stroke stuff, some things like that. Been getting more attendance each month. We're up at around 100 this past month, so it's been a good thing. Always open for feedback, topics, presenters. I've been getting some really good provider of the month nominations, so please continue. I really appreciate that support and makes it a good use of everybody's hour. So thank you. And again, always open to feedback or anything like that. I do send out a monthly reminder, so if any of you want to be on that email list, I don't spam you with a bunch of stuff. I send a reminder right before it goes off, and usually a summary email somewhere in between where you can look at the slides and kind of get the dates and things like that. So happy to add you to that list. We have 2 more programs in the state doing ground-based cold blood. We got Let's Fire down in kind of southeastern Indiana, and then Vernon Township Fire right down the road here. I think it's up to 8. We do have a whole blood coalition in the state too. I encourage everybody to get involved in that, because we're gonna start to pose kind of that interesting question of, we're gonna get to a point where, you know, how many programs can a state support? What's the supply gonna, that's gonna be the limiting factor until other type products come or storage things change. So we're gonna have to start having some discussions of how do we maximize that access for everybody, right? Do we look at, you know, figuring out ways to put them along major traffic arteries, or, you know, what does that look like? And so I do think there's some important discussions to have to be had over the next year or two. So certainly would encourage involvement from that side of things as well. The Rural Health Transformation Act dropped yesterday. For those that may not be familiar with some of the Medicaid contraction that's coming up from the federal level, this is kind of the acknowledgement that that's going to be very tough, especially on our rural facilities. They're sort of disproportionately dependent on Medicaid reimbursement. And so they've put a significant amount of funding out to go state by state by state. There's a floor of financing that each state actually applies for grants individually. Indiana has a 12-person team on that has a good EMS representatives and some, I guess, EMS allies on there as well. They've already identified some of our priorities. It's electronic interoperability, maternal health deserts, and EMS as a whole. So I do think we're very well positioned to, you know, make some changes there and support our rural areas. Some of you have already ventured here on this. If you haven't, and you're wondering why you haven't, you're probably going to hear from me very soon. It's a quick turnaround. We're talking like a few weeks. So definitely kind of gonna be kind of flying by the seat of our pants. We're gonna try to do some impactful stuff there. So I look forward to having some discussions with a lot of you as we move forward on that as well. I think that's all I've got.
Moving on to chairman's report direction. The only thing I have is we're approaching a time of year where the registration information starts to become available for NAMSP. Of course, the mayor went to several times, the Crossroads Conference coming up in French Lick, which continues to grow exponentially every year. If you've not been to that, I highly suggest being right here to be an excellent conference and an excellent venue. So knock out a fairly large amount of CPU. That being said, the next meeting at the Crossroads Convention on November 19th at 1 p.m. at the French Lick Resort in French Lick, Indiana. And with that, I will take a motion to adjourn. Motion to adjourn.